So today we're talking to Professor Vivek Jha. Vivek graduated from Patna Medical College, going on to complete his postgraduate training in medicine and nephrology from the Postgraduate Institute of Medical Education and Research in India. He is now the Executive Director of the George Institute of Global Health India and a Professor of Nephrology at the University of Oxford. Welcome, Professor, and thank you very much for joining us today.
Thank you very much for the invitation. Great to be with you.
So today we're going to be talking about COVID-19 and how India is coping with the current situation. Now, Vivek, I know you also have a background in regenerative medicine. The biggest risk factor associated with COVID-19 is age. Is this due to age-related comorbidities, or is it down to other factors?
So the first thing to say is that old age does not increase the risk of infection, but it certainly increases the risk of adverse outcomes if one gets this virus. So the data say that if one is under the age of 10 years, the risk of dying is less than 1 in 1,000. Whereas if one is aged 80 or more, then 1 in every 10 to 12 people will die. The reason for that is not very clear. One of the possible reasons could be a decline in immune system along with age. But as you alluded, old age is also associated with a number of other comorbid conditions. For example, increasing prevalence of hypertension, diabetes, cardiovascular disease, chronic kidney disease, etc. The other hypothesis that's been going around also is that old age might prime the immune memory, and therefore the immune response might be more vigorous. So, of course, there are a number of these theories that are going around, but it is a fact that older people have increased risk of adverse outcomes and death following the coronavirus infection. But as to the exact cause of this, there are a lot of postulates, but no definite answers yet.
So as of 2019, 9% of the world's population are over the age of 65. According to data from the World Population Prospects, by 2050, this will rise to 16%. This is almost a doubling. With this in mind, my question is, knowing that the elderly are disproportionately affected during epidemics and pandemics, how do we prepare for a future where a much larger proportion of our population falls into the elderly demographic?
Well, that's a very interesting question, which is much broader than relevance to the current pandemic. As to what do you do with the demographic change that is sweeping the world? There are many countries that have already reached that stage. For example, Japan has a huge proportion of elderly population, and they're struggling with providing social care, even finding enough working age people in their populations. And of course, providing healthcare to the elderly is a huge challenge. And it becomes even worse when in couples, one of the couple passes and there is just one left, and who will take care of them, etc. They, of course, carry a huge burden of non-communicable diseases with them. Non-communicable diseases often exist in combination. So multimorbidity is a huge problem in the elderly. When we talk about multimorbidity, we often confine ourselves to non-communicable diseases. Indeed, that's the paradigm that I have also been using. But we shouldn't forget that non-communicable diseases often can be complicated by a number of infectious illnesses. Those infectious illnesses can be community acquired just in the usual course. For example, pneumonias or urinary tract infection, etc. But when you have some large outbreak like the current one coming along, that further complicates matters. How to take care of elderly people who have these kind of infections, which by themselves require very expensive supportive care, is going to be a huge challenge for many societies, as we are realizing. We have seen already that a majority of the population that have died in countries like Italy, Spain, UK, etc., have been elderly, and health systems have to make really difficult decisions on who to provide care and who to simply refuse care. It's a big challenge. Many countries are preparing for it. Some are better compared to the others.
So following on from this, what is the role of regenerative medicine in the world of the future? Can we enable older people to live a truly healthy life rather than just coping with their chronic diseases?
Well, that's the utopian world that regenerative medicine researchers believe that they might be able to achieve. Uh, but it's fair to say that there's still a long way to go before we get anywhere closer to that. There have been a number of clinical trials of different regenerative therapy approaches for many non-communicable diseases, including ischemic heart disease, heart failure, kidney disease, liver disease, etc. There have been incremental steps which suggest that possibly there is a light at the end of the tunnel, but that tunnel seems to be really long. Of course, research which is even aimed to reverse aging is taking place. But how successful we will be in that remains to be seen.
So, globally, in the UK and many other countries, we've seen that coronavirus has disproportionately affected many ethnic minority communities. One report from the Intensive Care National Audit and Research Centre has found that 30% of the COVID-19 victims were from Black, Asian, and other minority backgrounds. Could you maybe give us some insight on what may be some reasons for this?
Yes, that data is very compelling now, and it's becoming clearer that ethnic and racial minorities are at increased risk of both catching the infection and also dying from it. So, what exactly is the reason for it is interesting. Is it something related to their genetic background, or is it related simply as a matter of deprivation, poverty, and disadvantage that a large section of the minorities and both ethnic minorities as well as minorities in other sense, even within a country, people who have been disadvantaged, whether it is related to that. One of the things that is clear that testing is delayed in minority populations, so often cases are not picked up in a timely manner. They, of course, are battling persistent health disparities, which are much older than the current coronavirus. They also have an increase in biological risk factors. We know that ethnic minorities are also much more prone to develop various other non-communicable diseases that increase the risk of adverse outcomes following coronavirus infection. Minority populations often live in conditions which are conducive both to the spread of the infection and also to delayed diagnosis. For example, they live in slums, they live in crowded housing situations. They often use public transport, which of course will make any physical or social distancing difficult. And they are much more pressing, they have many more pressing human needs, which make it much less likely that they will be able to stay at home and practice, for example, regular hand washing. In a country like India, minority populations may not have even access to regular running water, so they of course cannot wash their hands as is advised. If you ask one of these people to, if they are found to be coronavirus positive or come in contact with a coronavirus infected individual, to isolate themselves, it is not going to be possible because they live in a cramped room with several people. So there are a number of adverse situations that these minority populations are faced with, which makes both catching as well as dying from this infection much more likely.
So now, as I mentioned at the start of this interview, Vivek, you are the Executive Director of the George Institute for Global Health India. So I want to move on now to how India specifically is dealing with this unprecedented global situation. But first, I want to know, what is India's experience in dealing with pandemics and epidemics before? For example, the Spanish flu, SARS. Can you touch on that for a moment?
Sure. So India has not been untouched from pandemics in the past. You alluded to Spanish flu. In fact, it's not well known that the largest number of deaths from Spanish flu actually were in India in the last century. So, but then that was a very different time. There was a very different healthcare system. We were at that time under the British rule. Since then, India achieved independence. Infections were identified as the most important health priority in independent India. And the types of infections that were identified as being important included things like tuberculosis, diarrheal illnesses, leprosy, filariasis, and other such tropical illnesses. And India instituted a number of health programs which were kind of vertical health programs. India has achieved some spectacular success in curbing some infectious disease-related issues. For example, eradication of smallpox, polio, etc., have been success stories in India. But in terms of the other epidemics and pandemics, India fortunately escaped some of the large pandemics like the SARS in the early 2000s. But since then, there have been a number of other infections which have swept India from time to time. For example, the swine flu and the bird flu, and they have become more or less a regular feature. India also, Indian population regularly battles other viral infections, for example, dengue and chikungunya, etc., which are transmitted by mosquitoes. So those are real problems in India. And they have become more or less like background noise in Indian healthcare system. But still, they are responsible for a large number of deaths and people, living with disability for a certain number of days. In terms of the major viral outbreaks, one of the most recent outbreaks that India saw was the Nipah virus outbreaks, which was just a few years ago, which was primarily in the state of Kerala, which is in the southern part of India. Now, India, as you know, has a somewhat federal structure in terms of how a number of its programs, including health systems, are managed. And some states in India are more developed in terms of their healthcare response than others. And as it turns out, Kerala is one of the better states. And so the healthcare system in Kerala was able to mount an effective response to the Nipah virus and was able to contain it quite successfully. So there has been some history. India also has an infectious disease surveillance unit in its Ministry of Health, which was formed exactly for this purpose, to be able to track any upcoming infections and to develop and formulate policies on how to deal with them.
So, like you touched on there at the end, how is India now geared up to the sort of situation we're seeing now? How was it geared up before COVID started? Was it in a good place?
Yes. So it's fair to say that we are not in a very good place so far as the response to COVID is concerned. The Indian healthcare system, especially the primary healthcare system, has never been very strong in terms of its response to health problems that affect a large number of people, apart from the vertical health programs that we have successfully implemented. So the Indian primary healthcare system over the last several years has primarily been focused on around providing care for reproductive health conditions, to childhood illnesses, and to a few infectious diseases which were identified as priority illnesses like tuberculosis, etc. But in terms of its ability to respond to large-scale problems like the one that we are facing, it's fair to say that it is not well equipped. And that is what we realized when this virus hit us hard, or at least appeared that it will hit us hard. So in the first case of coronavirus in India was identified as early as late January in the state of Kerala, and so 3 cases were identified in quick succession, but the Kerala state authorities were able to isolate them and manage to contain the spread at that particular point of time. For a few weeks thereafter, the Indian health system continued to believe that possibly it might escape receiving a big hit from the coronavirus, and the authorities continued to reassure the population that this was not likely to be a big problem for India. So despite the number of cases increasing in other parts of the world, the containment steps that many countries started late, but not as late as India, were delayed here. And the only response that the Indian government took was to do a screening of arrivals at airports, thermal screening, and asking people to fill in a questionnaire, asking where they had come from. And that too started after about the first week of March, by which time the coronavirus pandemic was already upon us, and it was in full fury all across the world. So that was around the time when a number of public health officials and a few experts started developing models of how many cases we are likely to see. And according to some models, it appeared that India may have tens of millions of cases and deaths. Now, it's very difficult to say how accurate those models were because there was hardly any data until that particular point of time. But that seems to have really woken up the government, those very dramatic-looking numbers. And then the government of India suddenly decided to react, and the reaction that came forward was to order a lockdown. So India has been in lockdown since the third week of March. And this lockdown is likely to go on till the 3rd of May so far. A few states are, in fact, even mulling extending the date of that lockdown. But there is a lot of conversation in the healthcare community, in administration community, in the economic community, as to the adverse effects of such a lockdown on a number of aspects of Indian society, Indian economy, etc. And there are already calls for opening at least some activities. So we still have to wait and see how that goes. Now, so that's just one part, but the other part also, in terms of the response, is it's India's ability to expand the testing capabilities. So the testing criteria in India have been extremely stringent. And the number of tests that are being done in India are one of the lowest in the whole world. So as of today, the number of tests every day are about 0.02 to 0.03 per thousand population. And if you compare this with some of the countries that are testing their populations quite rigorously, like New Zealand, this number is almost 30 times that. UK has about 0.5 per thousand per day. Till today, India has done about 460,000 tests, which is very small in terms of the number of population that we have. There is always a big concern as to what will happen once the lockdown is lifted. A number of epidemiologists and public health experts are warning us that if the lifting of lockdown is not followed by a very high testing and tracing and isolation regime, we would have simply delayed the large hit that we would face from the coronavirus, but would not have made it go away altogether.
So as you've touched on, there's the lockdown in India. There was a very rapid lockdown, and it was very widely criticized. What's your own assessment of the way and how this has been handled?
So I think the first thing to say is that at the time when the decision was made, this was perhaps the most prudent decision that the government could have made at that time with the data that it had. And so it made that decision. And the second thing to say is that the lockdown has been received quite favorably by the middle class and the upper class. And it's been implemented quite rigorously. So the law enforcement has been behind it. And in most cities, the lockdown is I would say, being enforced quite rigorously. Now, the story is quite different for a large section of Indian population, which is not so well off. So we are talking of people who are daily wages laborers, who work in informal sectors, and who depend on earning their living during the day to have food on the table or on their floors in the evening, or to be able to send home some money after earning money during the day. Often they don't have a place to live, and so they live in very informal settings. Some of them live outside on the roads. And so suddenly, if they are out of a job because all the businesses are closed, there is no activity taking place, they are not earning anything, they don't have any place to live, they don't have any food to eat, etc. So they were left with no choice as to than to just find their way home, because that is where they felt that they would be able to at least have a roof over their head, and possibly if they could go back to their families, they might be able to at least muster up some food, etc. But what had happened by that time is that public transport had closed, and so they didn't even have a way to get home. Many of these people in desperation started just walking home. In some instances, even a few hundred kilometers, without food, without water. And so we heard stories, really heartrending, tragic stories of people even dying on the way. They had to depend on handouts, because if they had to continue to walk or travel for several days, of course, they could not do it without food. And a large number of not-for-profit organizations, citizen groups came together to provide these people with help, with water, with food, and with other amenities. So that's been the story of the lockdown so far. It, of course, has put a big stop to all the economic activity. And the challenge now is what will happen once again when the lockdown stops.
What you've said is actually part of the reason of what I'm going to say, but there's been a lot of pictures of workers on the streets in some parts of India. What can the government do to help, for example, either reduce the spread of the coronavirus there, because there's social distancing might not be possible, there's like crowds of workers, and how can the lockdown be enforced in that way?
It's very difficult, and I'm not sure there is an correct answer, or even even midway correct answer to that particular question, because it is pretty much impossible to enforce social distancing measures, as you noted. What will happen after the lockdown ends is that people will have to start moving back and forth once again, moving from cities to rural areas and rural areas back to cities. And whatever containment has been achieved in the last 3 or 4 weeks, we have to wait and see what has been the effect of that containment. If that containment has not been able to completely eradicate the infection, there is a risk that the infection can spread from one part of the geography to another part. And the risk is that if it goes from cities where the focus has so far been to rural areas, because of the lack of testing capabilities in rural areas, it might become uncontrollable at that particular point of time. But that is something that still remains to be seen. The government says that it is expanding its testing capabilities, and whether it will be able to expand it in such a way that it is able to reach remote locations, rural locations, etc., is not clear at this point of time.
Apart from the lockdown measures which has been enforced, do you know of any other mitigation policies that the government has enforced?
Unfortunately, no, not at this time. The only mitigation policies are the lockdown and testing. In some states, the enforcement has been much better than others. And I again come to the example of Kerala. So the state of Kerala actually took note of the spread of this infection a bit earlier than the union government. And the state of Kerala enforced some kind of lockdown, but it did it in a citizen-friendly manner. For example, it made sure that the people who did not have access to food were delivered food, even at their homes. And children who used to go to school and receive midday meals were delivered midday meals, even when the schools had been closed down. Their ability to inform the citizens seems to have been much better. and their outreach and the social involvement in implementation of the all the measures that are required for containment has been lauded as perhaps very citizen friendly, and it seems at this particular point of time that the number of new cases in Kerala has gone down quite substantially. But like I said, it's early days yet, and we still need to wait and see what happens when the lockdown is lifted, whether the number of cases will rebound.
In such a highly dense populated areas such as slums, are there specific healthcare tactics for these sort of areas where social distancing is virtually impossible?
That's a great question, and I don't have a very good answer to that. So what the government is doing is pressing the informal primary healthcare workers. So there is a cadre of healthcare workers in India called Accredited Social Health Activists, or ASHA. These are frontline healthcare workers who live in the community and who interact with community members and have deep insights into how communities live, behave, and interact with each other. And the government is pressing this cadre into a COVID response. And what they are doing is that they're going out and trying to identify high-risk areas and people who are likely to come in contact with other patients infected with the coronavirus. And the only response at this time is that the government declares those as the so-called red zones and puts people living in that area into quarantine and literally cuts them off from the rest of the people living around them. And it hopes that by observing a kind of containment for, say, 2 weeks or 3 weeks, will be able to prevent the spread of infection from that area. But all the people living in that red zone are still susceptible because many of them, if it's a slum area, will not be able to really practice any kind of physical distancing.
And what has the healthcare system specifically done to prepare for the effects? Is there adequate PPE? And you mentioned that testing facilities were not up to scratch before. What's the actual state of these in India?
So in terms of the testing facilities, until recently, we only had the nucleic acid testing, in which the viral RNA was targeted for diagnosis. But just over this week, the Indian government was able to import some antibody testing kits, which are supposed to be quicker in terms of their turnaround time. They don't identify the viral genome, but they look at the development of antibodies in response to the virus. It takes a few days for the antibody response to come. But as it turns out, just today, the news came that some of these antibody testing kits, which were imported from China, were found to be defective in terms of their sensitivity and specificity. So the government has, in fact, imposed a ban on the use of those test kits until it can figure out their test performance. And so we still remain in a state of limbo whether we will be able to expand our testing capabilities. Because there was a lot of hope that if these antibody testing kits start working, then we would be able to quickly ramp up our testing capabilities. But that seems to have hit a break at this particular point of time. So that's in terms of the testing capability. But our healthcare system, while it continues to be focused on coronavirus, we also need to remember that we also have people with other conditions. For example, a large number of non-communicable diseases. Just over the 1 month period that we have had the lockdown, it is estimated that 1 million people would have died of non-communicable diseases. Now, this is not something which is unique to this month, but this happens every month. So we shouldn't lose sight of the fact that there are other illnesses. And as our health system response focuses entirely on coronavirus, the care of people with these pre-existing diseases has suffered quite substantially because they have been totally cut off from the existing healthcare systems. Outpatients have closed down. Many hospitals have been taken over for management of COVID patients and have been designated COVID facilities. So there has been a substantial curtailment of services so far as the rest of the health system or health conditions are concerned.
We've seen India and Pakistan as still having a relatively low number of reported cases compared to many countries, particularly in Europe and America. That's a number that really surprises me, and that's also really surprises epidemiologists, because I think that was a third of what they initially predicted. So what's the scale of the difference between the number of reported cases, so the people who have been actually diagnosed, and the true number of cases in India?
Yes, that's an interesting question, and it has a two-part answer. One is related to the health system. So as I said, India, the number of tests that it is doing relative to its population is extremely low. So if we test fewer people, we will find fewer cases. That's the first thing. Having said that, it's also a fact that we haven't still seen a large number of people with severe coronavirus infection, reaching hospitals and dying in hospitals. So it is possible that the lockdown has affected that, and it has prevented the spread of infections which otherwise might have happened had the lockdown not been in place. So that's really something which is very important to point out. But as I said before, we don't know whether it has completely managed to suppress the infection, or has it simply delayed the onset of infection, and that it might come back now once the lockdown is lifted, and the peak which otherwise might have come in April might come in May or June. So that's something which we still need to wait and see. There are a number of other interesting hypotheses which people have put forward as to why a country like India, Pakistan, or some other countries with similar geopolitical situation might be immune. For example, it has been suggested that our countries are countries with high malaria prevalence, and so there might be a degree of inverse relationship between the malaria endemicity and the likelihood of developing coronavirus infection. This is based on epidemiological associative data, and this is something which still in no way has been proved or even substantiated in a substantial manner. And there are a number of other people who feel that the immune profile of South Asian populations might be different. The third hypothesis is that the relatively high temperatures in countries like India and Pakistan might have slowed down the spread of coronavirus. And as the summer becomes even more intense, possibly it will further prevent the spread of coronavirus infection. So these are a number of possible hypotheses which are being postulated as biological explanations for a relatively low number of cases with coronavirus. But like I said before, there is a real big question around the number of people we have tested in really being very sure whether we are truly seeing less number of cases, or is it just an artifact of less testing?
So we've discussed a lot of hypotheses, statistics, or like healthcare tactics that India has used. I was wondering, how does the India media actually represent the COVID situation? So as a normal citizen, I guess, of India, if I look at the news, would I get the ideas that we just discussed, or what would I get from the news?
So Indian media is a multi-layered medium. So we have a vernacular media. So we have, as you know, a large number of languages, and people who live in rural areas, people who live in different states, they often depend on their vernacular language medium, whether it is newspaper or television channels, etc., for news. And then we have the large English medium, and so the English television, English newspapers, which is the medium that the elite of India are used to conversing with each other in and accessing their news through. But India also now has a very vibrant alternative medium. So most of these media platforms are online. So the online news portals, and we shouldn't forget the role of social media here. Social media has become an extremely important source of information for people in all parts of India. So having provided you with this background, the information that you get in these various media platforms is extremely different. So the television, both vernacular language television and English television, is to a large extent quite sensationalistic, and since the number of cases, the information around that is very strongly controlled by government, there is very little likelihood of an investigative reporter, especially in this lockdown situation, going out and actually doing investigations on real on-ground situation of both the coronavirus and its response, both by the society and by the health systems. Now, what has also happened in India is that over the last few weeks, there have been a number of very disturbing incidents. In some incidents, there have been examples of discrimination against a particular section of the society. Now, whether it is people who come from the northeastern parts of India, who bear a facial resemblance to people from China because of shared ethnic origins, they have been discriminated against in certain parts of India. A few weeks ago in Delhi, there was a large religious gathering of a Muslim sect in a mosque. They gathered together in a very confined environment, several hundred people, and a large number of them actually got coronavirus. And once they spread out from the mosque, they went to different parts of India, and they also went, in fact, even overseas. They carried the infection with them, and they, of course, they spread it to other people as well. And in a somewhat divided Indian political environment, this became even a religious issue, that a certain section of Indian society started to blame Muslim community in general, rather than just that one particular gathering, as having been responsible for the spread of coronavirus infection. So these kind of conversations get amplified sometimes, especially on social media, and create a toxic environment in certain pockets, at least. The third thing that happened was the social stigma associated with coronavirus infection and the fear in the minds of people. And that fear manifested itself in a number of ways. So, for example, a number of healthcare workers who otherwise would come and work in hospitals, they became fearful that if they go to hospitals, they might catch the coronavirus infection. And this got compounded by the fact that there was not enough supplies of PPEs or personal protective equipment. So many healthcare workers simply started to abscond from their duties, or even started striking work quite overtly. So that became an issue to an already stressed healthcare system. And in some instances, because of this kind of social stigma, even the society started discriminating against people who worked in various medical professions, including doctors, other healthcare professionals. Say, for example, there were even stories of people being evicted from their rented accommodations just because they worked in a healthcare environment, and there was a fear in that housing society that this person might come back with an infection and might infect the entire society. So all kinds of misinformation have created a toxic environment in some parts of India, which is unfortunate.
In terms of India going forward, if you were, say, given the role of the health minister today, by some strange turn of coincidence, what would you do to go forward with this? What would be your plan?
the job of the health minister is going to be perhaps the most difficult job. It used to be said that the most difficult job in India was the job of the Indian captain of the Indian cricket team, but I suppose it has now been replaced by the job of the health minister. It's going to be extremely, extremely difficult because, as we discussed, the healthcare challenges in India have always been immense, and they're going to be multiplied several folds. Now, one good thing that one could say has come out of it is that health has become a subject of conversation front and square, which has not been the case in the past. Is that people are talking about healthcare as an important issue in their lives. Politicians, bureaucrats, etc., are very conscious of the need of delivering healthcare. So we are all hoping that this might bring in much needed long-term health reforms in the Indian healthcare system, and that the reforms that will come in will not necessarily be focused only around COVID, but will be much more deep-rooted and address the fundamental problems that exist with the Indian healthcare system, which means focus on primary preventative healthcare, ramping up our ability to detect illness early and respond to illness early. In terms of short-term response to the coronavirus, I think there is no escaping the fact that we need to ramp up our ability to test people for coronavirus by a couple of orders of magnitude and take it to remote locations. Pick people early as we can. Of course, we test them and we trace their contacts and we isolate them if we are able to find them. So that has to be. So this is the standard epidemiological response to any infectious outbreak, and we have to go back to fundamentals of epidemiology and management of outbreaks. So there is no going away from that. But having said that, we also need to be mindful, as I said before, that the other healthcare problems in India have not gone away, and people with the other healthcare problems also are deserving of attention. And it will be really a pity if just in order to pay attention to the most current coronavirus epidemic, we forget to take care of our people with other health conditions. So while coronavirus response is important, it needs to be weaved into taking care of people with other non-communicable diseases. We haven't even talked about the gender dimensions related to this infection. So while we spoke about minorities, there is of course a gender dimension. What happens to women? What happens to pregnant women, etc. Those issues need to be discussed and sorted out. And that if we are able to not suddenly, but it will take time, of course, increase the number of people that we have interested in primary healthcare delivery, both medical professionals, but also non-medical professionals. We have to train a large number of primary healthcare workers who are able to fan out much more easily than doctors, because the number of doctors is very small and doctors are expensive. Relying on doctors is not a sustainable strategy. So upskilling our primary healthcare workers in their ability to identify people with symptoms that might suggest onset of an infection like the coronavirus infection, direct them to appropriate testing facilities, give them an appropriate and reliable test, get the results back in real time, and then after the results are out, then doing the response that is appropriate to the test result. Having said all of this, social protection is extremely important. That people who will be affected, say, for example, if someone requires isolation, they need the social protection as well during that time, not only for themselves, but in many instances, if such a person is the breadwinner for their family, the entire family needs social protection. So the government has taken a number of economic stimulus packages, announced a number of economic stimulus packages to take care of some of these problems. But according to experts, the stimulus packages that have been announced so far are really very small, and the response needs to be much, much greater in order to be able to address the entire needs, both health needs as well as social needs of all this population. A longer term problem is going to be finding employment for all of these people, revving the economy back up, all the industries that have closed down, all the informal sector that has sort of shut shop, making sure that they receive sufficient stimulus to be able to get back on their feet again and re-employ the people that are currently out of job. It's going to be a long-term challenge. So this is not the job just for a health minister, but for the entire society. So we require a whole of society approach and a whole of systems approach to deal with this pandemic. Now, it's also fair to say that because of the reasons that we discussed earlier, it is very unlikely that coronavirus is going to be gone from amongst us in the next few weeks or even in the next few months. It is very likely that this will stay with us for several months or even years until maybe a vaccine is developed and a large number of people get vaccinated or a herd immunity develops. So the entire healthcare system will have to be restructured in such a way that healthcare delivery is combined with making sure that people are protected from this infection as well. And just to give you an example, if you come to an busy public sector hospital in India, you will see the outpatient department really overflowing with crowded spaces, large number of people sitting without any space in between, so literally touching each other. That, of course, is not going to be possible in the post-coronavirus world. So how do we change the entire healthcare system, including even redesigning the way our hospitals are built, the way we manage the inflow and outflow of people, patients, healthcare workers from within the hospital? All of that will require a careful thought.
In the near future, the global focus will start to turn from lowering the infection rate, at least with the first wave, to relaxing the lockdown measures and reopening the economy. How pertinent is it for a country with the sheer population size of India to time this perfectly?
I think it's fair to say that there's no perfect timing for this. There are a number of experts, including economists and healthcare experts, who believe that there should not have been any lockdown, and that the lockdown in India is not worth the price that the Indian economy will pay. In fact, arguments have been made that if lockdown was the answer to any healthcare problem, then lockdown should be imposed just to reduce the number of road traffic accidents in India, because lockdowns will reduce road traffic accidents. And every year, according to estimates in India, 150 to 200,000 people die of road traffic accidents, which is a huge number. Lockdowns have reduced the extent of pollution in India, which will, of course, will have a beneficial health effect. But we don't impose lockdowns to prevent adverse health impacts of those problems that we have. So according to these experts, lockdown was not the appropriate response. And if you ask them, they will say that lockdown should have been lifted 2 weeks ago at least. So there is no perfect time. I think in terms of how these decisions are made, I think this will be based on an estimate of the current number of cases and what is likely to be the incubation period that will prevent the spread of infection from the residual number of cases. But it seems, at least so far, that the number of new cases being discovered until yesterday has still been going up every single day. So if that was the only criterion, the lockdown should be extended even more. But of course, as I said before, this is not something which the Indian economy, the Indian system is going to be able to tolerate at all. And so it is very, very unlikely that the lockdown will be extended beyond the current deadline, which is for May the 2nd. The lockdown will be opened. Now, what is the manner of opening that lockdown is something which still remains to be seen. According to what we hear, the plan from the government is to identify which are potential high intensity transmission areas. As I said, identify some of these red zones and keep the lockdown enforced in those red zones, but slowly open up areas where the transmission has been shown to not have occurred in the previous certain number of days, like previous 2 weeks and so on and so forth. But eventually even the red zones will have to be opened up, and it remains to be seen how successful we will be in having contained this virus at that time.
If we look even further onwards into the future, what if a different coronavirus, say COVID-25, makes a return? How prepared would India be then?
We do hope that it will be better prepared. As I said before, I think this has been a big wake-up call for healthcare systems around the world, but for particularly healthcare systems which so far have been relatively immature, like in India. And it will be a pity if we don't take away this lesson of preparedness for the next one that's going to come. Now, according to most experts, with the kind of climate change that we are going through, the loss of biodiversity, the number of infectious disease outbreaks is only going to increase in the future. There is enough data to suggest that it has already gone up in the last 25 years compared to the 25 years before it. And so this is something which is entirely predictable. And if you go back and hear Bill Gates, he actually warned the world in his TED Talk in 2015 to be careful of the next pandemic. So the next outbreak will come for sure, and I'm pretty sure that we will be better prepared, but it will require a huge amount of investment. As the viewers might know, that the healthcare spending by the public sector in India is quite low. It is just about 1% of the Indian GDP. The Indian government had announced its intent to raise it to 2.5% by the year 2025. But I think that will have to be revised upwards very quickly if our healthcare system needs to be better prepared to meet with any next such pandemic.
So to finish the podcast on a slightly more positive note, is there any positives we can take from this situation?
I think the biggest positive, as I said, is that health has become an important issue for the government. And as many public health experts, including people like us, have been saying that for an India that is aspirational, that wants to grow fast, it is extremely important that the governments take care of the health of its population. Most successful economies have first address the health-related issues of its populations, especially the essential primary healthcare services. We do hope that this crisis actually provides us with an impetus to continue to walk rapidly on the path to providing good quality essential healthcare to our population in a way that is sustainable, scalable, and affordable. It sort of conforms to the Sustainable Development Goals to provide healthcare to all, and to reduce or, if not completely eliminate, out-of-pocket healthcare spending by providing people with universal health coverage. I think that will be the most important thing that would have come out of this crisis.
Brilliant. Well, thank you so much for joining us today, Professor, and thank you for providing us with your comprehensive knowledge of the current situation in India. Thank you for doing it, everyone, and we'll see you next time.
Thank you, Chris. Thank you, Raymond. Thank you for inviting me for talking with you.
Thank you very much. Goodbye.
Bye-bye.